I know you guys are really worried about UKMLA and what it means and how it's going to change things. And how will you prepare? So we had touched a little bit on our last video about how there are some changes in the format. And some of y'all asked us, can we actually look at what are those changes and understand what could potentially be coming? So that's what we're going to do. We're going to understand the PLAB blueprint versus the MLA content map and how this exam pattern is changing in the future.
If this is the first time you're checking out our channel, welcome. Basically what we do is we run a website that's totally free known as roadtok.com, and it will explain the ins and outs about everything related to the United Kingdom and what it takes for you to work as a doctor in the NHS. So if you've not already, please stalk us on all of our social media. Find us on Facebook, find us on Twitter, Instagram, and of course, YouTube. Don't forget to subscribe.
Hey guys, Ibreez here. Alright, the first thing you need to understand is if you're watching this video and you have no idea what MLA is, or you want to know the parts of the MLA or anything about the MLA, we have a video about the MLA. We're here just talking about the difference in the exam formats. Okay? We're not going to get into the nitty-gritty about what the MLA is or what's happening with how that exam is being processed and whatever it's going to entail in the future. The two things you have to kind of just first understand is, yes, PLAB is being replaced by the UKMLA. Yes, both PLAB and the UKMLA are being used to give you a license to practice as a doctor in the UK. But the methods by which this is now being assessed, the things that they are doing and looking at, are changing. This isn't just me saying this. This isn't just something I've decided, let me talk about this morning and see how everyone feels. This is what GMC has outlined several times on their website. So if ever you have doubt, access their website. They have all of the information laid out plain and bare for you to look at. Let's first look at what exactly were they using, by they I mean GMC, as their source of understanding for how to create the PLAB blueprint. So for the PLAB blueprint, they were taking some of their guidance from GMC's Good Medical Practice, which you guys can access online on the GMC website. They were taking some of their information from the outcomes for provisionally registered doctors. This is something that they had written up, if I'm not mistaken, in 2015, and from the 2021 UK Foundation Program curriculum. So that is what they were kind of looking as resources on how to develop the blueprint itself. Now for the UKMLA, what are they looking at to obtain the information for the MLA content map? The first thing that they're looking at is the outcomes for graduates, again by GMC, which came out in 2018. The second thing they're looking at is the generic professional capabilities framework, again by GMC in 2017. And then they're going to be looking at parts of the UK Foundation Program curriculum. They haven't specifically stated what parts of the curriculum. I'm considering it's probably the curriculum as a whole, or perhaps as the curriculum shifts from year to year. But that's what the basis for the information is going to come from. So you can already see at its most foundationally, basic level, they're looking at different resources and how to form and shape the exam. So it doesn't necessarily mean a lot might change. Maybe not much will change. Maybe a lot of what they're talking about is the same stuff, but maybe they're going to be highlighting different things in this new exam. Maybe they're going to be concentrating on different aspects. Like I said, though, these are all available on the GMC website. You can look at them and have your own thoughts as to what might be different or what might be changing in terms of what they're looking at. Now, let's look at the PLAB blueprint first. Okay, so the PLAB blueprint is still available on GMC's website. It is an Excel document, which I'm not a huge fan of Excels anyway, mostly because they can tend to look a little messy. And that's kind of the first initial concern I have about this blueprint. Not that it detracts from the information it's providing, but I just like things presented in a nice, neat way. And I feel the way it's put here, it's a little haphazard and a little chaotic, kind of squished together. So you might struggle to actually understand, what am I looking at? What am I not looking at? Especially because they've got a little bit of the information for PLAB 2 in terms of what they're looking for in your capabilities and competencies. And then they have a list of a lot of things that they're looking at overall. Now, the biggest thing that I find trickiest, so if we just actually look at the content map, is the way they've kind of arranged things is it's very, very generic. you'll look on one side, they've just listed stuff like blood and lymph, breast, cardiovascular, child health. Then in the next column, it'll be something about it, pallor, fatigue, heart murmur. And then I guess their specific part of it when they'll say any cause. Or they'll say including risk factors or arrhythmias of any cause, depending on what that topic was. It's pretty vague. I mean, you might sit there and think to yourself, at least this is how I am. Okay, they've told me this is the information I need to have. Based on this information, what do I feel like I might need to study? Or what do I feel like I really need to revise when I go over these particular systems? So I feel like this is a little bit more difficult when you look at the blueprint. And because of how generic it is, you might struggle to actually, on your own, understand what to look at. And then for their aspects for PLAB and 2, I think actually are okay, because they've given clear domains and what they're looking for. So that part of it I'm not too mad about. But if we look at the MLA content map, so if I just pull up the content map now, first of all, it's a PDF. It is also available in an Excel form, but like I said, I don't really like Excels too much for these things. A PDF is nice and neat. The added benefit with this PDF is it gives you a lot of background information for you to understand, what you need to consider, why the MLA exists. It also helps you understand that there are 2 components to the exam, the Applied Knowledge Test and the Clinical and Professional Skills Assessment, so the AKT and the CPSA. So when you actually get past all of that stuff, where they're explaining the domains, explaining the aspects that you have to understand, they talk about the areas of clinical practice. Initially, it seems a little vague as well, but they really take the time to go more in depth as you progress through the PDF. I especially like that they've kind of split it into 2 ways. So you can look at it as a list of presentations, so just generally, allergies or addiction or rash or cough, crying baby, whatever. And then, if you're really interested to actually, let's try and conceptualize what's happening where. If you go down further, it does a really nice job of actually presenting it by mapping it to different areas of clinical practice. So the first section is accidents and emergencies, so emergency medicine. And they've got a column of presentations and a column of conditions. So for instance, for the first one for acute and emergency, it says abnormal urinalysis. So you would be looking at a setting in the emergency department where you see a patient who has an abnormal urinalysis. So what could have happened there? What could be the potential reasons you either did the test or the findings from that test? Personally, for someone like me, I find this helps me know how I can prepare. Yes, there are things that you can always just generally know as a doctor, but if you look over this and you think to yourself, actually, I'm not sure if I understand all of this completely, you have a way to look at it in different ways, because you know as well as I do that different clinical practices will value different presentations in different ways. They'll have different ways that they'll want to approach it, different examinations, different managements. So having that is in your understanding is really important at the end of the day. All right, let's take a pause. How many of you are currently panicking? How many of you are not panicking? How many of you have stumbled upon this video and have absolutely no idea what you're doing here? Okay, look, the purpose of this video is not to cause panic. The purpose of this video is for people to realize things are changing. I think there are definitely some people out there who are in denial that PLAB is changing to a new exam, and that they think I'm just gonna close my eyes and walk into the exam hall and bubble in some answers and it'll be fine. Except, as I've said, that's not gonna happen, especially because AKT is gonna be a computerized exam, not a bubbling in one. So that's gonna be the first probably strange thing that's gonna happen. They'll be like, I've come with my pencil, I'm ready. What do you mean I need to use a computer? So, how are you guys supposed to prepare for an exam that's changed so drastically? We've already mentioned it previously, but I'm going to spend a little bit of time just mentioning it again. We have come out with the ultimate UKMLA Qbank. The importance of this Qbank, first of all, we have taken the PLAB, so we understand how the blueprint works. We've worked in the NHS for a few years now. I was part of one of the think tanks that helped the MLA kind of form what it was formed into. Ibrahim's part of a lot of the implementation and understanding of the MLA curriculum in our local medical school that's associated with our hospital. He's actually a clinical assessor for a lot of the medical students. So yeah, he's a big nerd, isn't he? He does all this teaching stuff. It's great. So, and he also is getting a degree in exactly this, medical education, understanding how to put together the stuff that helps you understand what you have to do. I'm only saying this because I want you to understand how seriously we have taken this question bank, because our biggest concern is, since it's going to be something that's implemented for both local graduates as well as international graduates, we do not want our people to fall short. Y'all know how to take exams. These are not the types of exams that you are unfamiliar with. It's just that the pattern and what they're looking for is changing. And we want to prepare you for those changes. And that is why this Qbank exists. I want to say we first thought about the Qbank when there was the first initial talk about MLA a few years ago. You know, they were saying so many times, oh, first it's going to come out in 2021, then maybe 2022, and now they're saying 2024. But I want to say it was probably around 2019 that we sat down and started scripting out how could we go about making this a successful question bank. So I want you guys to understand we put a lot of time, effort, dedication into creating the ultimate Qbank, and that's why it is the ultimate UKMLA Qbank, because it will cover every aspect of the content map. Now, if you're kind of one of those people who are like, that's great, you've put out a question bank, but I still want something to understand and read that's tangible beyond this. First of all, we're trying to do that with our explanations in the Qbank, but second of all, I appreciate that completely, which is why right now we're also working on a revisions type course that you can access and use as a supplement. And even if you're still in medical school, but you've got your heart set on the MLA, it's something that you can use alongside your medical knowledge and information as you obtain your medical degree. So don't worry. This isn't the first time they've gone and changed things on us. It's probably not going to be the last, but the important thing is remembering that we're here to help you every step of the way. And if you still feel like there's other stuff that you want to talk about, you can always book a personalized guidance session with us. But of course, until next time, continue to subscribe to our YouTube channel, follow us on Facebook, Instagram, and Twitter, and we'll see you guys next time. Bye.